All right, in the first video for chapter 5, we were looking at carbohydrates. We kind of looked at some of the biochemistry, kind of what the structure looked like. We talked about some of the main function, how it gives us energy mainly, and we looked at the differences between some simple carbohydrates, simple sugars versus more complex like fiber or starches go. And we even kind of named some of the main ones. And so now we're going to look at a few other things. Hopefully, you got a good background now of what a carbohydrate is and kind of what it's used for in the body. We're going to look at a few other things. Section 5 here. We're just going to mention a few things about the figure here that's from your textbook. I don't think it's too surprising what they come up with here in the figure. It's looking at the average percentage of calories from some of the major groups here, the carbohydrate group, the overall fats and protein. How many calories, how many average calories are we getting per each of these nutrient groups? It may be somewhat of a limited study. It's looking at just kind of a one-day snapshot. It's only looking at adults. It's only looking at U.S. Residents there. And so it may be somewhat limiting, but it gives us some information. By far, we get most of our calories from the carbohydrate section, and it's about 46%. They break it down into kind of the sugar category. That could be, the like fructose or the simple sugars, monosaccharides, or even disaccharides like the sucrose that we find in the table sugar or what we use to cook with, and then about 25% or so from more complex carbohydrates like starches and plants, and the fruits and vegetables that we eat, but also fiber and things like that would be in that category as well. So a lot of calories coming from carbohydrates, even more so than fats. Now, fats have a lot of caloric value, a lot of energy associated with fats. In fact, on a per gram basis, you get about 9 calories per gram from fats versus about 4 calories per gram from carbohydrates. But again, we're intaking more carbohydrates as a whole versus fats. Not too surprising that only about 15% or maybe a little bit more from protein gives us calories. Protein's not a huge energy source. We use proteins for other functions in the body, but you do convert some protein into energy. And so we'll be looking at that in another chapter. But so just kind of consider, where we're getting our calories from. And again, by far, the average is getting most of our calories from the group of carbohydrates. And so with that, one of the things that we can look at is if we're in a position where we want to try to limit or try to decrease some of those carb intakes, maybe we need to step down the carbohydrate amount in our diet. The textbook does a good job of just kind of offering some suggestions, some tips along the way. And so one of the things it looks at is to try to, instead of, if you need a snack, try to avoid the candy bar scenario or the sugar type scenario, and try to find some fresh fruit or maybe some raw veggies, some carrot sticks or some nuts. Try to be careful about salt. We'll look at that in another chapter as well. But try to find unsalted or lightly salted nuts or something like that instead of a sweet or salty snack. Go for yogurt. Yogurt is great. I'm not a huge yogurt fan, but a lot of people eat a lot of yogurt. It's usually very good, but you do have to be careful for some yogurts that contain a lot of added sweeteners, and so you do have to be a little careful there of what you're putting into the yogurt. If you're adding a lot of things to it or adding extra, maybe brown sugar or sweetened like dried fruits, you have to be careful about the sugar content there. And another good way to limit carb intake is to kind of take a look at our soft drink intake. If you're a soft drink person, if you're drinking a lot of sweetened soft drinks, then that's definitely a place where you could cut back on some of the carbs by drinking water, staying hydrated. Maybe if you just don't want to drink plain water, but maybe you want to have water with a little lemon in it or a little bit of lime juice to give it a little flavor there. And that would help to decrease some extra or added carbs. Section 6 just has us looking at a nutrient label, and hopefully you had a little time to kind of explore some of the information here on the nutrient labels. We'll look at these for each of the nutrients that we're covering, like carbs and proteins and fats. So for the carbohydrates, if you notice that there is a section here, the nutrient labels and the nutrient fact label is usually pretty consistent. It's usually standardized so that it's easy to read and it's easy to compare, different types of foods. Usually has, a carbohydrate section dedicated to that. And so one of the first things you'll see is total carbohydrate, and that is what it sounds like. It includes any kind of carbohydrate. It doesn't matter if it's a simple sugar or a starch or fiber content. It all is included in that number. So this particular nutrient label we're looking at is some type of dessert cookie or something. Of course, it looks at the serving size. That's important because that's what these numbers are looking at. One serving is 150 calories, and we have to go back to the serving size, which means if you have 5 cookies from this package, then you have 150 calories. So one serving gives you that number of calories. So one serving of 5 cookies would include a total of 24 carbohydrates. Don't forget they give you also the percent daily value on the side here. That's your kind of your recommendation there. And so if you had 5 cookies from this package, that is about 9% of your recommended amount for carbohydrates. But also notice below that, they break down fiber and sugar. And so they give you the dietary fiber, the complex carbohydrate there. Turns out for these cookies, there's 0 grams, all right? So that's 0%. They also give you the total sugar content. These are your simple sugars, your mono or disaccharides. This is probably something like fructose. This would include high fructose corn syrup if that's used to sweeten it, or sucrose or something like that. And so total sugars is 11 grams here. Notice also they include something called added sugars. So if it's a sugar that is naturally present in the food, then it's just part of this total sugar. But notice that this package here contains 10 grams of added sugar. So that means 10 grams came from a sugar that they added when they're making the product, but just 1 gram of sugar was something that was already present. All right, so they added 10 grams to it. That brought the total amount of sugar up to 11 grams. One thing that's slightly confusing is if you notice there's no category there for starch. Starch as a complex carbohydrate. They list the fiber. They list sugar, but they don't tell you the starch directly. So that just means you have to do a little quick calculation. And so all you have to do is subtract out anything here under the total. So the total sugars, you subtract out the total sugars from the total carbohydrate, and that'll leave you with the starch. So for this example, you've got a total carbohydrate content of 24 grams. 11 came from sugars. And so if you subtract those numbers, you'll get 13. If I did the math right, you'll get 13 grams. So that means that this has 13 grams of starch that's part of this total carbohydrate category. And then usually down below, they'll kind of give you a little bit more of where those carbohydrates come from. So this particular one, if you kind of look close, you've got some flour there. That's going to be some starch included there. You've got sugar that was mentioned here. You've got dextrose, which you mentioned here. You've got corn syrup. So they're listing down below where those carbohydrates are coming from. And this is also just another example of that. All right, section 7 starts out with a question. Are carbohydrates fattening? That's kind of maybe a misleading or perhaps even a trick question. It really comes down to how many calories are we taking in and how many calories are we using or burning or expending, right? And so and it depends on a lot of things. The book kind of mentions a few things. Well, it depends on what kind of carbohydrate, because we've seen there's different types of carbohydrates. It certainly depends on what amount are we taking in versus how active we are. It depends on the individual's metabolism. One thing to consider, and you probably have realized this, is carbohydrates don't tend to satisfy our overall hunger satisfaction as much as fats do and as much as proteins do, especially proteins. And so what that means is if you have a high carb meal, that may not seem to last very long, and you may be hungry an hour or two later or 3 hours later, versus if you have a more protein-rich diet or meal, then that would seem to last a little bit longer for you. Many times snack foods, of course, are going to have sugars and fats along with it. So they kind of have a combination there. A lot of metabolic factors go into everybody's a little bit different. Your metabolism may be very high, and so it doesn't really matter how many carbohydrates you're eating because you're burning them very, very quickly. Or, you maybe have a little bit slower metabolism, and it seems that it's taking a little while longer for you, or working harder for you, to burn up those extra carbohydrates. And so those carbohydrates, if they're not processed and burned for energy, they're going to be stored. The body's just naturally going to store those in adipose tissue or fat tissue. And so one thing to kind of think about is that sometimes it's important to kind of combine carbs and fats together. Foods containing added sugars and fats have a lot of that energy there coming from. Those are those two main categories that we saw on that opening figure of where our calories come from. And so you get a lot of that energy, but just remember, if your metabolism is not burning the energy, or if you're not able to burn off that energy, it's going to be stored, and it'll be stored as fats. And there again, we kind of mentioned already, sugar-sweetened foods, or especially sugar-sweetened soft drinks. That's a big source of added sugars in our diet. So the next couple of slides kind of takes a little turn, and it kind of looks at, well, what problems are associated kind of in the carbohydrate area? What problems and what health concerns do we have that seem to have some connection directly to carbohydrates? One may be a little unfamiliar, or maybe even perhaps even a little confusing: non-alcoholic fatty liver disease. It says here that fat builds up in the cells of our liver, hepatocytes. Once that happens, that causes some inflammatory response, and that can actually damage our liver cells and perhaps even destroy the liver cells. That causes something called cirrhosis, which is a scarring type tissue of the liver, which means those liver cells are not going to function like they would normally. And so, the connection here is that you may not realize that fatty liver disease is connected to carbohydrates, because once you have an excess of carbohydrates, maybe your fat diet is okay, you've limited some fats, but if you've got an excess of carbohydrates that you're not able to burn and consume, then those are going to be converted into fats, and those can build up and adversely affect the liver. So there is a connection there. Prevention, treatment, these are pretty obvious. Losing excess weight is definitely going to help. Obviously, watching our diet. The alcohol portion here, that's just going to help the liver out anyway, because alcohol literally poisons the liver. But you can have this fatty liver disease even without alcohol, because that's why it's called non-alcoholic, if you have high levels of fats or high levels of carbs in your diet. Just about everybody's heard of diabetes. And so this is where you're not able to really process the glucose that's inside of your blood. It's difficult for someone with diabetes to get the glucose to decrease from their blood to get that glucose into the cells, mainly inside of those liver cells and the muscle cells where it needs to go to be processed. There's several types. These are the two main types. You may have heard of these, type 1 and type 2. Type 1 diabetes has been shown to be an autoimmune disease. Your body system is producing antibodies and literally attacks your own cells. It turns out that you have specialized cells called beta cells that are inside of the pancreas. Their job is to make insulin. So individuals that have type 1 diabetes, their body, for whatever reason, there's still a lot of research going on about, kind of looking at autoimmune diseases. But for some reason, those antibodies attack the beta cells, destroy the beta cells. Usually it's at an early age. So this is usually has an early onset. And it causes the body to not be able to produce insulin. And so the person is going to be dependent on insulin. That's type 1. The insulin, of course, is a hormone that helps to get basically the door open to allow the glucose to go into the cells where it needs to go. That's because that's where all the machinery is to take that glucose and turn it into energy, right? Type 2 diabetes, that's more common. You hear about this more often. This is usually known as insulin resistant or insulin independent diabetes. And so that kind of has a combination. The cells, muscle cells and liver cells especially, start building up a tolerance to insulin. And they, for some reason, aren't able to kind of open that door again, to kind of let that glucose get inside of the cells where it needs to go. Sometimes there's other medications that can help with type 2 diabetes. Many times, eventually, the person may end up taking insulin to kind of, after years of struggle with this, they may end up having to take insulin. But as you see in the chart here, the cases of diabetes has been steadily increasing, actually pretty exponentially increasing there over the past 2 or 3 decades there. And a lot of that seems to be connected with carbohydrate intake. Couple risk factors there: sedentary lifestyles, excess body fat, and they've shown a genetic connection. So just kind of be aware of that. There are other types of diabetes, gestational, which takes place in pregnant women, and studies have shown about 9 or 10% of pregnant women may develop this type of diabetes during pregnancy. There's some problems associated with that because it does increase the chance of having problems during the pregnancy, miscarriage, premature birth, even a stillbirth, perhaps even birth defects. And so it does have to be checked on, tested for. Pregnant women that are usually at a higher risk are those that have a family history of type 2 diabetes in their family, perhaps that are overweight or even in the obese category, and continue to have kind of a high chronic high blood pressure, chronic hypertension there. Usually, most studies show that once the woman has delivered the baby, and usually they'll find a decrease in those symptoms of diabetes. So it's more of a temporary condition. Controlling diabetes, definitely monitoring blood glucose. That needs to be that's very important. Now you can find devices. Everybody's seen the finger prick test, a little blood kit test. Probably now they even have devices that you put kind of. They're still temporary, but they last usually weeks or even months. On the arm, somewhere on the body, and that, with the I guess Bluetooth or whatever, it directly connects to your phone or your mobile device, and you can check it in real time. That's pretty amazing. You may be checking your what's called hemoglobin A1C. You may have heard of A1C. That's kind of a measurement of how much glucose is kind of sticking inside of those red blood cells, and that's important because that kind of gives you a view of your blood glucose levels over like several months. It almost kind of looks at a several month snapshot there. Definitely watching diet, definitely increasing exercise, physical activity, all these things help controlling diabetes. A couple of words for you. Definitions: hypoglycemia. That prefix you've probably seen before. Hypo means lower than. Emia refers to what's in the blood, and the glyc right there, GLYC, that's referring to glucose. And so hypoglycemia is low blood glucose levels. And so you can kind of see your fasting blood glucose. If you go 8 to 10 to 12 hours without eating, your blood glucose levels are going to go lower, around 70 milligrams. You don't have to know the numbers there. And so 70 to 99 is kind of your normal range after fasting. If you fast and you have your blood glucose level checked and it's somewhere between 100 and 125, then you're in a pre-diabetic category. If it's above that, then you're in the diabetic category. But if it's too low, then you're hypoglycemic. And that can lead to some very serious problems there. Another thing that can be associated with carbohydrate or excessive carbs is something known as metabolic syndrome. A syndrome is kind of a group of symptoms that have some which generally occur together. And so these for metabolic syndrome are some symptoms. You wouldn't necessarily have to have all of these, but individuals that have several of these symptoms occurring together have what's called a metabolic syndrome. Large waist circumference, usually because of excess body fat in the abdominal area. High blood pressure, we're talking about chronic high blood pressure, long-term hypertension, having a high blood fat level, looking at triglycerides, elevated triglycerides in the body, lower HDL. The HDL is your kind of the good, quote unquote, good cholesterol. We'll talk about these a little bit more when we get to the lipid chapter. But this is actually a helpful version of this. This actually helps to get rid of some of the cholesterol in the body. But if that gets too low, again, that's just one of these criteria for metabolic syndrome. And then, of course, having high blood glucose levels. Lactose intolerance, not near as severe as, I don't think, as some of the other topics we've already mentioned, but you may know some individuals that experience lactose intolerance or some degree of this. Lactose is a disaccharide. It's glucose and galactose put together form lactose. Because it's a disaccharide, you have to have an enzyme called lactase to digest it. You have to have that enzyme to break those bonds, actually chemically separate it. So some individuals have lacking that enzyme or lacking sufficient quantities of the enzyme, and that leaves that lactose in their intestines longer, and so that generally leads to the bacteria that we naturally have in the intestines kind of feeding on it. What that means is when those bacteria kind of feed on it, it leads to a lot of extra gas or bloating, perhaps even cramps because of the gas, and diarrhea, different GI tract symptoms there. So treatments, of course, you can just avoid lactose, but again, lactose is found in milk and dairy, and so a lot of people want to have milk and dairy in our diets. You could take some type of lactase supplement or pill, and that is the enzyme that help kind of break down the lactose. Or you can find lactose-free dairy products now. And so those are all options as well. Fiber, we mentioned a little bit about fiber. Fiber is a complex polysaccharide, complex carbohydrate, very important. Studies have shown that it helps to reduce the risk of obesity, even type 2 diabetes, if we have high fiber in our diet. We get this from fruits and vegetables, especially things like oatmeal. It even helps with intestinal tract disorders, helps kind of get rid of some extra cholesterol and fats, which means if you get rid of those, you can help individuals that may be susceptible to heart disease, coronary artery disease, stroke, and even some cancers, especially colorectal cancer. Last couple of things we'll look at. Section 8 mentions two words here, glycemic index and the glycemic load. You may be familiar, may have seen glycemic index before. This is a measure of, that's kind of your book definition, a measure of how quickly a food causes our blood sugar levels to rise. Not all foods, it may be kind of surprising, not all carbohydrate-rich foods will be equally absorbed by the body, equally getting into our bloodstream at the same rate. And so that changes what's called the glycemic index. So let me show you the table, then we'll come back to glycemic load in just a minute. But if you look at the table, this is from your textbook. I've seen different glycemic index values, but this is the one that your textbook uses. And so what they did, they kind of order these or rank these in order from the highest glycemic, the food with the highest glycemic index to the lowest. And they just selected about 15 or 20 examples here. At the top of the list for glycemic index are potatoes, russet baked potatoes. So if you eat a potato, that has a higher rate of being absorbed into the blood quicker than something like maybe carrots would, raw carrots. And so carrots have a very low glycemic index, which is better for us if we're watching things like diabetes or if we're watching things like carbohydrates. It's better to eat lower down on that glycemic index. It may be surprising that even something like a candy bar, it has a lower glycemic index than just a plain baked potato. It just depends on what kind of carbohydrate is there, what type of sugar is there, how quickly does it get absorbed from the intestines, makes its way to the bloodstream, and affects our overall glucose levels. Okay. One of the issues with glycemic index, not really an issue, but one of the things here is it doesn't take into account really the overall serving size that you're looking at. So, you know, it says potato, russet baked potato, but what size are we talking about? Is it a small potato, large potato, whatever? And so that's where glycemic load comes in. It takes the information from the glycemic index, but also tries to correct for, you know, what size serving are you looking at, which is very important. And so what they did here in the table, and you don't need to know the numbers or anything, but here they did was they say, well, what if you kind of balance everything out, looked at everything and said, okay, you're talking about a potato, but you're talking about 150 grams. You measure it out. That has, it's still a high value, but that's glycemic load value is now more comparable because you're all looking at the same amount of potatoes. There's no question now. You're looking at exactly 150 grams. It has a value of 26 on this scale. Okay. If you're talking about jelly beans, well, how many jelly beans are we talking about? You wouldn't know if you're looking at the glycemic index, but if you're looking at the glycemic load, you're talking about exactly 30 grams for that serving size has an effect of 22 on the glycemic load index. Right? So that's the only difference there. Glycemic load gives you a little bit more, I guess, realistic value because it's taken into account the serving size that you're looking at. So if you increase the serving size, then you would increase that value. All right, so I hope this was helpful to kind of go over Chapter 5 on carbohydrates. And hopefully you got a good understanding now of some of the overall characteristics, their functions, some examples, a little bit about the structure, and how they affect our overall health. We'll do this in a similar format for the other macronutrients as well. Thanks, guys.